Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. We've been discussing allergies all month, and today we're going to discuss food allergies. And before we get into it, though, if you have not already, please hit that subscribe button. This helps us get the word out so more people can get this information. You're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a double board certified family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. You can check us out at www.intouchprimarycare.com. So let's get into it. Allergies. Allergies can significantly affect the quality of life of adults and children, and it's been associated with several conditions and behaviors in both children and adults. So allergies should be properly addressed and not just ignored. Food allergies are common. They're about 20% of the general population reports allergies to either a specific food or food group. So what causes food allergies? Well, food allergies tend to happen when the body's immune system overreacts to a food protein. So food allergies can be IgE mediated, which usually means that happens. You have that allergic reaction within minutes of eating whatever it is you're allergic to, or they can be non-IgE mediated, in which the reaction happens later. Or sometimes it can even cause chronic symptoms or long-standing symptoms. So non-IgE mediated symptoms mainly result in abdominal symptoms. Okay, so you can have allergies that cause reactions right away, or sometimes you're allergic to something and you don't react to it right away. It takes time before you react to it, or it causes symptoms that are prolonged. Okay, so what are common allergy symptoms? So actually, there are 8 major foods that cause majority of food allergy symptoms, and many of you know them. They're milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. So those are the most common food allergies that affect many people. And there's something interesting that you may have noticed if you have food allergies is actually sometimes there's cross-reactivity between allergy to pollen in the environment and allergy to foods. So for some patients, the allergic reaction to foods become more severe when they're exposed to another allergen like pollen. So, for example, they may eat something that they usually are not allergic to, but when they're exposed to a high pollen count, it causes reactions. So we see this in people that may, for example, have like a ragweed allergy. And then when they eat melons or bananas, they have a reaction to that, when typically they could eat melons and bananas and not have a reaction. But when the pollen count is high, they would have a reaction. Or say they have an oak tree allergy and then they eat eggs or apples and then they react to that when typically they wouldn't. So we know that sometimes there are certain foods that can cross-react with environmental allergies. Another thing that can happen is when certain foods are combined, they cause allergies, when if they were eaten separately, they wouldn't. So for example, some people, when they eat wheat and they pair that or eat that with a banana, they'll get an allergic reaction to it. But if they ate them separately, they wouldn't have any symptoms, or the symptoms would be really mild. So there can be things like that happening in terms of allergies. So when you're aware of what you're allergic to, it helps. And it can explain some of the things that might be happening that you need to kind of avoid, or separate foods, or understand when the pollen is high, I should avoid this and that sort of thing. Okay, so what is the most common food allergy in adults? So there is something called oral allergy syndrome, and that's the most common food allergy in adults. It affects about 5% of the population. And usually what happens is it causes itching of the mouth and the throat when they eat raw fruits and vegetables. But when those foods are cooked, they're fine. So the person can tolerate them when it's cooked, but when it's raw, they have an allergic reaction to this. And some patients think it's because there are chemicals on the fruits or vegetables, but this is actually not the case. It's because what happens is when the proteins that cause the allergies are heated, it destroys them. So it can be destroyed either by the heat from cooking the food, or it can be destroyed by the acid in the stomach when it reaches the stomach. But unfortunately, it needs to pass through the mouth, right? So it causes an allergic reaction in the mouth and throat. But when it's cooked, that's not an issue. Usually, oral allergy syndrome causes like swelling of the mouth, the face, the lip, the tongue, and the throat. And it's really with just contact with the food, with raw fruits or vegetables, and sometimes with nuts too. And typically, people will have symptoms within minutes of contact with the food. So it's considered a contact allergy, and usually it happens with people that have some sensitivity to pollen as well. So some people will have that and also will have seasonal allergies or environmental allergies. The other common food allergy, seafood allergy, which is like, fish, shellfish, which is very common as well, with up to 2% of the population globally allergic to seafood. A lot of times people think, studies are showing that it's actually more likely that majority, 40 to 60% of people develop a seafood allergy in adulthood rather than childhood. So you may have been able to eat seafood when you're younger, and then you may find that now you're a little older, you're not able to eat it anymore. But the good news is that usually most people that are allergic to seafood are allergic to either one or more of the finned fish, or one or more of the shellfish. So usually you're not allergic to both groups. You're either allergic to the shellfish group or the fin fish group. So that's good. So many times you can eat one or the other. But you don't know for sure until obviously you're tested. Some people can be allergic to both, and that's less common. In about 10% of people that are allergic, they will be allergic to both. But many times 90% of people that have a seafood allergy are only allergic to one or the other. So when somebody may be allergic to shrimp, they may be able to eat, fish, for example. So when should you see an allergy specialist? Well, anybody with food allergies, especially those food allergies that happens within minutes, should see a food allergy specialist, except the symptoms are very mild, like oral allergy syndrome, like I mentioned, in which case you can follow up with your primary care doctor. And then all people with nut allergies also should probably see an allergy specialist. Food allergies can be very serious, and so it's important to find out what food you're allergic to. And if you have, environmental allergies, though, that's something that we can help with here at In Touch Primary Care. And if you're anywhere in the Texas area and you're interested in learning more about that, just call us, give us a call, 713-280-9985. And you can learn more about allergy testing and treatment. Thank you for listening. That's all we have today. Remember, subscribe and share with someone. You never know who may need this. It may make a huge difference for them. And remember, your health is too important to rush. It's too important to ignore. We need our health to enjoy doing what we love. So prioritize your health today. And remember to share. And I will see you next week at 2:15 p.m. Thank you.